Advancing Parkinson's can lead to changes in your loved one's behavior and personality that are hard to deal with. In part 1 of Thinking Changes, we went over strategies to help with confusion and memory problems. Here, we will dive into the difficult subjects of hallucinations, delusions, and dementia. Confusion or hallucinations may occur with disease progression or as a side effect of Parkinson's medications. The term hallucination means that someone sees, hears, or feels something that is not physically present. It is not a dream or a nightmare, but occurs when the person is awake at any time of the day or night. Hallucinations can be bothersome or frightening and should be reported to the medical team. Medications can sometimes help, but if pills are prescribed, they should be the type called atypical antipsychotics. Other medications given for hallucinations may make PD symptoms worse. Delusions may also occur. Delusions are illogical or irrational views that are not based on reality. They are not deliberate and cannot be controlled. They are very real to the person with Parkinson's. Paranoia is the most common type of delusion, where an individual becomes suspicious. Delusions may involve accusation of marital infidelity or fear of being poisoned by medications or food. If the person feels threatened, he may become argumentative, aggressive, agitated, or unsafe. If your loved one has hallucinations or delusions, it is usually not helpful to argue with them. Avoid trying to reason. Keep calm and try to be reassuring. It may be okay to say that you do not see what they are seeing, but some caregivers find it more calming to play along and acknowledge what the person is seeing in order to reduce their stress. For example, if they see a cat in the room, it may be best to say, "I will take the cat out," rather than argue that there is no cat. This is not viewed as lying to your loved one. Some people use the term therapeutic fibbing. In addition to hallucinations and delusions, some people with Parkinson's experience changes in personality. They become anxious, moody, irritable, or even aggressive when they were not like this before. Try not to get angry or take their behavior personally. Your loved one is not acting out on purpose.
It's natural to get frustrated, and you feel guilty when you do because you may lose your temper, and you just have to walk away, and you have to remember they're not the same person they once were, and this disease is doing this.
Instead, try to speak in reassuring tones. Consider what may be causing the behavior. They may be hungry, tired, in pain, frustrated, lonely, or bored. Try these tactics. Move him to a different environment or area of the home, or distract him. Change the subject. Ask for help with some other activity, or suggest a coffee or cookie break. Humor can diffuse stress, but make sure that your loved one understands the intent of your remarks. Apathy, or lack of motivation, can also make caregiving challenging. Your loved one may not have motivation to participate in the daily routine. It is hard to offer continued encouragement, but it is important to keep your loved one as active as possible. It is worthwhile to find some type of engaging activity. Finally, Parkinson's disease dementia can occur, interfering with daily activities such as eating, dressing, and speaking. Reasoning, memory, and judgment are also greatly impaired. Someone with dementia is not safe to be left alone due to confusion and disorientation. People with dementia may enjoy situations that are familiar or represent past experiences. For example, a homemaker may like to fold towels from a laundry basket or wipe a table, counter, or sink. An office worker may like to sit at a desk, sort papers, use an adding machine, or perform other tasks that are reminiscent of a past life.